on your.
Yes.
Thank you. Go ahead, Jay.
Thank you, Thomas, and welcome you all. We are celebrating today Mental Health Awareness Month. GOPIO Health and Wellness Committee has organized this program. We have done that last year as well. And today we have our panelists here. We have Dr. Mohini Ranganathan and we have Mini Santosh. So I will introduce them as I call them on the stage, to speak, and then they will also introduce themselves. So, Dr. Mohini Ranganathan, she is Associate Professor of Psychiatry at Yale School of Medicine and practicing psychiatry for nearly 20 years. Her work focuses in treating adults and psychiatric illnesses such as depression and schizophrenia. Her research work has focused on the effects of cannabis on mental health and more recently, mental health awareness and treatment access amongst South Asian Americans. With that, I would like to invite Dr. Mohini Ranganathan.
Thank you so much. Good evening, everyone, and thank you for joining us today. So the focus of our conversation today is really to start and continue conversations around mental health, because as all of you know, since you're here, you clearly recognize the value of kind of having these conversations in our community. It is something that we don't often do, whereas as a community, we are not immune to mental health problems. And so it is really imperative that we continue to have these conversations. We know that certain types of mental illness are highly prevalent amongst children, young adults, and certainly people at all ages of life. What we also know intuitively is that some communities access care or talk about mental health lesser than other communities. I certainly think that is true for our community amongst Indian Americans. So, last time we had a conversation that was really personal. We heard from children and young adults about their experiences in the silence. And that kind of inspired me to not go on anecdotal, just conversations between friends, but to look a little deeper to see, are we just missing it? Maybe all of us are actually are aware of mental health problems. We know how to access care. We know how to engage in this. It's just my perception that we don't. So I looked at the literature. I'm a scientist. So I looked at the literature and I found almost no literature on Indian Americans, very, very little. There is literature on people in India, but there isn't much literature on people in Indian Americans. And so I actually put out a survey. It's still ongoing, so this is very, very early, but I'm going to share that with you. And the reason I'm sharing that with you is not because this is a really important data for all of you to know, but it's because it goes to the heart of the problem, which is what is our level of comfort, our level of awareness, and what can we do as a community to actually improve that. So it's just a few slides, and I'm hoping it will spark your interest and maybe even discussions. So let me just share my screen. Okay. I hope you can see my screen. Please let me know if you cannot. So the title of our survey is SAHAS. It is South Asian American Healthcare and Access Survey. It's conducted out of Yale University, where I'm faculty, and we have full IRB approval. So it's a very valid and regulatorily approved survey. It is completely anonymous, and it is designed for adults who are of South Asian origin who live in the United States or are visiting in the United States. We have about 80 people who responded to this survey. This is just really a very brief snapshot. Our target is 2,000. So this is very small, but this tells us that already the uptake was so quick that we know that there is interest in this conversation amongst people from our community. Most of the people who participated in this survey were immigrants like me, so people who had themselves immigrated to the United States. Most of them were fairly highly educated. The surveys in English, most of these people indicated that they spoke English and were comfortable in talking in English to their providers. That was an important question for us because we wanted to make sure that language barriers didn't play a big role in access to healthcare. This survey doesn't answer that fully because the survey is not translated into other Indian languages, but that we will be doing that in the future. So this is kind of a representative sample of people who are highly educated, immigrants, people maybe who live in bigger cities. Okay. So let me walk you through this figure. On the left side, you see how often we South Asian Americans access healthcare for general medical problems, that is GMC, and how often we access healthcare for mental health problems. So at the bottom in orange is no, we don't access healthcare for anything. So in the bottom, you see general medical problems. Around 30% said they did not access healthcare for general medical problems, even though they had the problems. But close to 70% did access healthcare for general medical problems. You can see the pattern is flipped for mental health. So close to 60% did not access care for mental health, even though they had some mental health problems. It wasn't a surprise to me. It just validated what my clinical impression and community-based impression was, but it was really startling to see that in data, because it means we have to do something. We have to change this pattern. Clearly, it's not about accessing healthcare, it's about accessing mental health care. And we found that stigma played a bigger role as a barrier for mental health care access compared to general medical care access. And we asked questions not only about individuals, we also asked them to reflect if their family needed some care and whether they had challenges being aware or accessing healthcare. And as you can see in the bottom, for general medical conditions, the numbers are really small. So stigma did not play a big role for themselves or for their family members, whereas stigma did play a larger role for themselves and an even larger role where their family members were concerned. Sorry, my slide is not moving forward. Okay. So that is great to find out this information, but that's not where our question ends, right? Like we wanted to know, I want to know as a psychiatrist, what can I do to change this? What are the gaps that need to be addressed? By far, the large majority of our respondents said, yes, we do need more information about mental health care. Close to 65% said yes, and about 30 some odd percent did not respond. So really only a very small percent, 5% said, no, we have enough information. We don't need any more information. That's the circle on the left side. And then on the right side, we said, okay, how would you like some of this information? And we asked people to rank each of these items on how strongly they agreed with the statement. And I'm not going to go through this busy slide, but they wanted information about where are mental health services located. That's the dark blue item on the very bottom. Another item which we intuitively thought and was confirmed by our respondents was that they would really like to have some culturally sensitive mental health care access. So that's the line item in gray over there. These are all items where over 50% agreed that these were important. So location, how to access mental health care, maybe shared language, shared cultures, maybe some conversations about mental health problems among South Asian Americans. And then we asked, you want all this information? How would you like this information? In what medium? And certainly information at doctors' offices was one, but talks by experts, community conversations, maybe social media sites, websites. So really people were quite open to a variety of ways in which information can be shared by them. It need not be one size fits all, but it shows that there is lots of opportunity to grow this information. Okay, so then we said, okay, who do you usually discuss your healthcare conditions with? Who are these people? Who are your go-to people? And not surprisingly, a spouse or significant other was the most common person that people spoke to about their mental health problems. And the second was a friend or colleague. Now, while this is not surprising, it means we can grow this conversation through community initiatives. They don't always need to touch base with a doctor or a psychologist or a therapist or a nurse in order to get that information. If you kind of get information to one or two members in a community, one or two members in a family, you have an opportunity to disseminate that information to grow those conversations. And then we said, whose opinions on healthcare matter the most to you? And not surprisingly, the first item was spouse or significant others. And the second was doctor, nurse, or professionals. So we are really, this validated our idea of how we might want to develop information, what sort of questions need to be answered, and how we can disseminate it. We can do it in a multi-pronged approach. Certainly doctors, community conversation like what we are having today, but also low level of continuous information, whether it's flyers at the doctor's office, email lists, websites, social media talks, etc. So I'm going to end, I don't want to bore you with data. I know we want this to be a bi-directional conversation. I think that I just want to say that the early bit of data that we're getting, it completely confirms our feelings that there is lack of adequate conversation and awareness about mental health problems in our community, that there might be some reluctance to engage in the conversation, but there is also equal amount of desire to engage in the conversation. And what we need to do is to provide enough kind of resources and spaces to have these conversations. This is a flyer for the study. If you have any interest in taking it, or you have any interest in sharing it with your family, friends, or others, you can certainly scan the QR code right now, but I think we will also be sharing that with all the registrants after this talk. If you have any questions for me, my name is Mohini Ranganathan. My email is just a yale.edu email, so mohini.ranganathan@yale.edu. I'm happy to have any conversations with you. Mental health problems are front and center for us, but especially for our children and our youth. And this is an opportunity for us to really engage in conversations around that and make a difference. And I'll stop there.
Good job.
Thank you so much, Dr. Mohini. And we have other panelists. I'm also one of the panelists, and Mini Santosh. And after our panels, we will have question answers. So I ask all the participants, please get ready with your questions and share your questions in chat. And I'll select some questions for the panelist. Okay, so I'm Dr. Jaya Daptardar. I'm Ayurvedic doctor. I'm president of GOPIO Connecticut and chief compliance officer for Bridges Healthcare. So as we all know, these behavioral health challenges, they are not for certain community. So they don't skip any gender or race or ethnicity or any demographic group. And anyone can experience these challenges regardless. So it's the more important thing is how to identify the early signs of this. How how an individual deals with these challenges is tied to that person's lived experience, culture, and beliefs, and other things. So what I'm going to talk about from healing point of view, how to recognize the health of your mind and how to identify the behavioral changes and how to address them. And I'm going to go through some slides very briefly, and then we can discuss after. So let me share my presentation. Okay. I have a little disclaimer there that this presentation is just for the educational purposes and not to treat or diagnose. So I have this slide here that is the statistics from NAMI. Millions of people are affected by mental illness each year, and we have a lot of resources to, to go and get the treatment or therapy. So this is not a thing that you can work or perform your duties, or as long as you identify or someone in the family identifies and get the treatment, there is treatment available. So 1 in 5 US adults experience mental illness, and 1 in 20 US adults experience serious mental illness. 70% of youth 6 to 17 years old experience a mental health disorder. So these are the significant, percentage, the numbers. So what we need to do as families, we need to make sure whenever we find the early signs in the kids or adults, you need to get help or find the resources for them. So this is the definition, the health defined by the definition of health by WHO. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That means health is not just the physical health. It's equally important, the harmonious balance of physical and mental health. And according to WHO, if you look at this diagram here, it also shows the harmonious balance of mind, body, and spirit. The community involvement, the social interference is important for the behavioral health, the health of the brain. The self-care system is needed. The lifestyle, the management of lifestyle and the self-care system is needed for health of your brain. And that's what I'm going to go through today a little bit through my slides. So prevention, awareness, and wellness. What it does, it saves the time, money, and suffering of the individuals if you identify the signs earlier than later. It saves sick time for the agencies and schools. It improves your productivity when you identify and treat. It is important for the schools or the agencies or even the corporates to pay attention to wellness programs for balanced behaviors. So this is, and no one is perfect. I mean, this is a perfect one here. This is the balanced individual, which is not only the balance of the body, mind, and soul, but harmoniously balanced with the nature. And I came across an article from SAMHSA yesterday. The article was talking about how the natural changes affect our brain or our brain health. Natural disasters or the change in the elements of the nature. Nature is made up of 5 elements, and change in any element, it affects us, our brain as well, our health as well. So it is important to make sure that our body mind is in balanced condition, but also it is balanced with the seasons and the nature. So how does that happen? So this is the definition of health according to Ayurveda. And what it what Ayurveda says about it is health is when you have balanced biological energies, balanced digestive fire, nourished tissues, regular elimination of urine, sweat, stool, and happy soul, elated senses, and a cheerful mind. So if everything is in balanced condition, then our physical and mental health is in balanced condition. But we're not saints. No one is perfect. So what we need to do, we need to identify the healthy signs and identify the signs of unhealthy mind. So we'll go through one slide here which talks about our self-power of healing. We all have our self-power. We just need to know how we use that power. So one thing it's always taught by the therapist and psychiatrist is touch, hugging. That is very important. Spreading love, talking to each other, smile, a kind word, a listening ear, all of which have the potential to turn around a life or to turn a life around.
Yes.
And your doctor won't tell you that. So signs of unhealthy mind. These are the simplest things that you can find out in your daily interaction. Psychological conditions caused by mental health disorders are anger. Simply, if people are getting angry spontaneously, short tempered, greed, jealousy, sadness or sad feeling, anxiety, nervousness, fear, unhappy feeling. So, according to theory of Ayurveda, the psychiatric conditions caused by the combination of physical and mental disorders are psychosis, convulsive disorders, hysteria, illusion, drowsiness, alcoholism is one of them too. So, these are the signs of unhealthy mind. So, causes of mind imbalances. So, what are the causes of these imbalances? I don't think there is a cause identified, exact causes identified for this, but some of these are the reasons which can trigger emotional stress, occupational stress, trauma, poor upbringing, influence from disturbed individuals, sexual abuse or drug abuse, access thinking are some of the reasons. All these impure actions cause too much anger sometimes, hate, fear, nervousness, worry, apathy, dullness, and sleeplessness. That is also, I think that's a bigger cause, the people who have this insomnia problem. So Ayurveda has a lot of strategies for prevention and wellness. I'm not going to go through it. I have limited time, but balance of body and mind, we always have to think harmonious balance of physical and mental health. How can you do that in your daily life? Just a simple way to do is manage your schedule and manage your life. That's what I always say. Ayurveda's lifestyle management according to season, like I said, the season affects our brain. The seasonal worst changes in the season, diet, sleep, exercise. These are the important things. Balance mind with yoga, pranayama, that is a breathing exercise, massage, and all other therapies are there. And finally, tune up with nature. Then there are, I just have some good pictures to show if you want to take a picture. This is about yoga and pranayama, herbal massage for rejuvenation and stress release. we call mind balance. Meditation is another one to practice. This is 3-season chart to balance with nature. This is nature clock. This is actually, I use this for lifestyle management. What time is a good time to wake up? What time is a good time to eat your meals? What time is a good time to go to bed? And when you follow, it helps to kind of discipline our body and mind. So with that, I have these resources and references. These are my books. And thank you. This is my website, my email if you have any question. Thank you. So our next speaker is Minnie Santosh. Minnie is a social worker. She works with Early Childhood Center. She's director there. And she can also introduce herself. So with that, I would like to invite Minnie.
Hi, good evening. And I'm just sitting through these conversations, and I'm joining this panel as I did last year, in the same capacity as an educator. So, what do I see on the other side of the table, as a stakeholder, being an educator, a parent, or an advocate for kids? So I go again. My name is Minnie Santosh, and I've been an educator for the last 30 years of my life, and have advocated for kids, ages birth through 12, and even further down. And I'm a motivational speaker. So, what does it mean? I go to groups of, be it issues related to mental health or self care. Um, we have those nice conversations. I do not come to this table with any kind of diagnosis perspective, because that's beyond my capacity. But as an educator, and have lived it, through different generations of kids who I've worked with over the last 3 decades, we have seen that mental health is, I hate to say that, but it is. We just went by, and we're still in a pandemic, but it's worse than that, because it is something we just look away, um, believing it's not happening. The parents look away, and thinking it's, moving away from, uh, giving it a very subjective definition, calling it, oh, they're stressed, or they're just tired, they're just having a meltdown. So we constantly hear that on the other side. As an educator, I have heard that, parents say that, oh, the child's just going through stress, or so it is sad. Just recently, after the pandemic, we're starting to see that there is a lot of attention that's brought importance to mental health as it relates to everyone, regardless of race, ethnicity, identity, socioeconomic status, religion, ability, or educational background. You see it. And it is something to be fixed. There's always been little band-aids put across and moved on, and that's when they get older, those kids get to be institutionalized. They fell through those cracks and were not being helped in a timely manner. Just recently, we are starting to see, the American Rescue Plan had the ESSERS money, funds, which is Elementary and Secondary School Emergency Relief Fund, the ESSERS. The previous rounds, we did see the funding did go into school systems to support work, that is unique opportunities to kind of reconceptualize how we prioritize and provide school and program-based supports for mental health in schools. That's something I advocate for. And those are conversations that I just recently ran for the office the last election season, because that was the first thing on the table for me, is the disparities when it comes to supports for children with these needs, when creating a nurturing educational environment for children in schools, especially elementary and secondary schools, which is totally neglected. Even early ed, I see that they neglected, saying it's just growing up, they're going through that. And then elementary ed, again, they see it, there's another band-aid put on that. They go to high school, there's another band-aid. That those kids are falling through those cracks, not realizing that's a serious problem they're heading and they're going through. And so right now we are constantly fighting for those funds, and we're happy that those funds has been geared in that direction, where we've dramatically increased the number of social workers, school counselors, so school nurses, and psychologists who have to be available on site for supports for students. An advocate who constantly, try and advocate for those supports for the last 2 decades. But we also see that it's a stigma, mental health. I hate to call that, but it's so true, and very predominantly seen in Black and Brown and Asian communities, where we just it's a historic misconception that people just ignore it, thinking that it's stress or just being tired or just going through a phase. So it's about time that we have, surveys and data. As I was just pleasantly, it was great to see Dr. Ranganathan, right, and even Jer talk about those the very specific data driven numbers to say, hey, this is a problem, and this has to be, before it gets to the finish line, it has to be fixed. So few things that I did over the years have been working with parents and educators and other stakeholders, be it the Board of Ed or the community at large. I said, what are the challenges we are looking at? Yes, rising mental health needs and disparities among children and groups. So what do you recommend for that? Recommendation will be to prioritize wellness for each and every child, a student, and even educators and providers. The second is the perceived stigma, which is a barrier to the access, right? We see that every single day. So what do you recommend for that? Enhance mental health literacy, and so that it reduces the stigma or other barriers to the access. The other challenge is inactive implementation of practices. It is so true. It's not evidence based. We have to make it more evidence based prevention practices. We just heard today, it was great to hear that, at least we are heading in that direction in this field. And then we have the fragmented delivery system. So, what does that mean? We have to establish a very integrated framework of educational, social, emotional, and behavioral health supports for all kids, and I would say even the adults. So that's the only way this crisis that I would say the young children and the youth in the United States have reached. It's reached a critical point that, and the pandemic has made it worse. So it is important. It's looked at that it is at its worst, and people take it. Educators, doctors, psychologists, people, community leaders, the political bodies. They have gear that attention in that direction. So we get all supports, and that's the way we celebrate Mental Health Month, not just calling it a Mental Health Month. And I'm straight sit through panels and have these conversations, so we get this to the finish line. That people understand it's just more than it just starts off as as an eating disorder or mood disorder or depression, or it starts off as something like that, but where does it get to? Are we fixing it before it gets to the worst situation of self-harm behaviors? So it's important we have those conversations. I'm glad I'm part of this panel. And I did meet the kids who joined us. They did meet with me again after the last panel, last year's meeting. I did join that group. We did make some connections, and I just hope they are heading. They had some great ideas as young kids, and I hope they took it to the next level. They are our cheerleaders. Our youth are our cheerleaders, and they are the ones who have to advocate for themselves, while people like us advocate for them and trying to look for hopefully a better world where people if you're willing to take a pill for a fever or a cough, why not fix a problem that is something very similar? Body's going through a condition. It's as simple as that. Why do you shy away from it? Or why do parents just totally define it different because of a stigma? I always tell parents when I sit across the table, I say, hold your children close and hold them closer when they are in that dark space, because they need you more than anyone else. That's all I have. And as an educator, to talk about this, I would call it it's beyond being, I can't even call it a pandemic. It's something so critical that we are shying away and looking away, thinking the world will fix it. We all together have to fix this. And I hope we get to hear more conversation. Thanks, Jerry, for inviting me to this beautiful conversation to share a little bit of me in this space.
Thank you. Thank you so much, Minnie. And I agree with you 100% that there is still stigma. And also, I would love to have like families join, not just one person, or with the kids, young kids, because young kids also need to hear all this. And like you said, it starts from a little bit where if you don't identify that as a family, then it grows bigger. um, and it's not just the body, treating your body, but the mind as well. It's equally important. And I hope there will be good questions for our panelists, Dr. Mohini, Minnie, and myself. We can answer. So start writing your questions in the chat box. If you want to just raise your hand, we can do that. But I would rather prefer the question in the chart so we can scan that question. Anything, Mohini, you would like to say before I get these questions?
No, I think, thank you again for having me here. I think it's really useful if we actually have a conversation. So, if you have some experience or you want to share a comment or a question, please chime in. I thought it was really helpful last year, and I hope we can continue to have those conversations. So nothing to add from my end.
Yeah, and I would encourage parents basically, because this conversation is more, for the family and kids. Last year, like Minnie said, the kids joined and it was really good conversation. So please have your questions in the chat box so I can see it, or raise
Hello.
your hand so I can see it.
Hello.
Hello.
This is Dr. Ramesh Pandey.
Hi.
I cannot do that. I'm not a computer guy, so I have to speak out.
Okay.
And I have a question.
Mhm.
This first thing is this good? I'm glad to hear this conversation about mental health awareness. Is there any connection in this mental health with autistic children? Because when the kids are born, I think it has to do something with the mental. And then you brought something very interesting. Environment also has something to do with this mental health. And but because summertime, I'm meeting some people who are autistic, autism, and all that. And I think the environment which they are being brought up, that could change their. So, any comments on that, please?
I can take that question. Autism is one illness, as there are so many other behavioral illnesses and mental illnesses, and regardless of the type of illness or the type of symptom that a child or an adult may have, I think it's really important for us to remember that there are several factors contributing to it. So there's the biological factor, there's a genetic factor, there's the birth complications factor. There is a psychological component. So there are experiences in utero, early childhood, all the way through brain development and even later in life, right? And then there's the psychosocial components, your situation in life, the resources you may have, early intervention, if you have early recognition, or too delayed intervention. So all of these factors contribute to how someone may manifest their illnesses. I don't think it is unique to autism or unique to bipolar disorder or unique to anxiety disorders. We understand these factors more in some illnesses and we understand it less in other illnesses. But if we always think that it's multifactorial, in a way that's actually great, because then you can intervene in a multifactorial way. You can have different ways in which we can actually have an improvement.
Okay, good. Thank you.
So I have a question here in the chat box. Do we currently have any websites or support groups specifically for Asians, South Asians? Also, as clinicians, have you seen Asians, South Asian patients? If so, how are they coming to you? Meaning, what were the path they took before finally seeing you as providers? It's quite intense, but Mohini, if you want to start with, then I will add.
I'll be brief. I think if you Google, there are certainly resources out there. You just have to be, some are excellent, some may not be. So you just have to kind of use your discretion in going through those. I should just let you know that as part of our SAHAS survey, the next step is that we're actually putting together a website with resources that will be citable, that can connect to things like NAMI, things like SAMHSA and other resources, but also trying to build resources that are regional. So some for Connecticut, some for, New Jersey. My clinical practice is at the VA hospital, so I see veterans clinically. So I do not have a large South Asian representation there. But part of the reason I'm involved with this is because over the past few years, especially through the pandemic, I get contacted on a weekly basis through word of mouth from colleagues and friends and relatives, people of South Asian origin, especially Indian people, who are seeking some advice for what they should do next for some problem that they are noticing. So it's an unofficial pathway through me. I do not have a private practice.
Good job. Good job.
Yeah, and then I would like to add a few things to this. Like Dr. Mohini said, you can browse, Google search for the resources. There are not certain websites, but if you're seeking for the support groups, it's not specially for Asians or South Asians, but there are support groups available. Also, as clinician, yes, I work in healthcare system. I work as a chief compliance officer, but I also work as a consultant for other healthcare institutions. And I have seen, and we have seen the Asians and South Asian patients. My psychiatrist, they have seen, and there is a shortage. I'm looking for psychiatrist and child psychiatrists because there are more patients than the ratio of psychiatrists where psychiatrist and the patients is kind of off balanced. There are more patients than the psychiatrist. So talking about South Asian patients. So South Asians are more, they're not open. So they come through the friends or families. Even I have, for the healing practices, I have clients as well. They're not patients, but the client just for the healing practices integrated with the other therapies that or other medication that they take. So they come after it grows bigger. It is almost to the stage that they have to get the treatment from psychiatrists for a longer time because they don't think that it is a problem. That's why I presented in my slides, and even Dr. Mohini and Minnie also mentioned that the first signs to recognize, to identify the signs is important and seek help. Find the resources. There is no shame in that. Actually, like if you have fever, you go to the doctor. So why don't you go to the doctor when the kid has ADHD problem or anxiety or depression or something like that? It's better for their life. And then there is another thing mentioned here. What were the path they took before finally seeing you as a provider? They did not. I have seen that they did not seek any help before until it's up to, you know, up to their head. So, and I have seen that more in Asians or South Asian community than any other community. Minnie, do you like to add something to it?
Yes, what I do see, um, as I included in the meetings in the community, when it comes to you know, I'm included in meetings in schools where the family wants me to go with them to be a part of those conversations with the school nurse or the school counselors or the psychiatrist. So I do go with them. And what I do see is even while the parents feel it is a problem and they're sitting at that table, they are not willing to accept it. They're still in denial. So when I get off that meeting, it's more than just the child. The child does not know any better. He or she's going through a process. It's a struggle. It's a struggle. It's up there, up there in the head. They're struggling with it. But the bigger struggle is the parents trying to give that help and just shying away from that in denial, saying, "Oh, this is just fine. India mein to hota hi rehta hai." This is what I hear all the time.
Right, exactly. Yes.
It's sad, and I walk away telling. And sometimes I call the schools and say, I do not want to be invited to such, because it's sad that a child has been denied service and exactly falling through the crack another time while I'm still there as an advocate for that child. And I hate to say this, sometimes I turn them in. I call DCF and turn them in because at that point, and I'm someone who celebrates the reunification when it happens, but I've turned them in telling that child it's neglect. When you're depriving care for even for mental health condition, that is neglect, according to me. So I've turned them in, and when it's all fixed, I always say I'm the first person to celebrate the reunification when it happens. But it is more than just the child because the parents are in denial. I've seen that a lot. And it's just not an Asian Indian community. We see in Hispanic and Latino community also. But because we're talking about the Asian Indian community, we see that it's getting better. I've lived here last 30 years. It is changing. But the part what I'm just trying to my 2 cents on the previous question is you don't really have to look for someone South Asian because the kids are born here. If they need services or someone right here, a provider who's not a South Asian, you go for it. It's not about, if you're comfortable, we understand that part. But if the need is for the child and there is a provider there, don't fine tune it, don't narrow it down. You just, you're going to be in a waiting list, staying there for the longest time before that help is plugged in. The most important thing is the time. The sooner the child gets help, the better it is. It's be it a provider from your own community, your own descent, or a provider who's just not, do not look like you or talk your language. Go for it, because at that point you're losing time. You're speeding against time. So that's my 2 cents for this.
Yeah. So if you identify early, then you avoid all these things.
All of this, absolutely.
Yeah. So I'm just looking at the questions. Thank you all for creating this time and space to talk about this important topic. Thank you. This question is for me. Can you explain where you practice? Where do you practice Ayurveda in Connecticut? So I have telehealth practice and also practice in Weston, Connecticut. And you can just Google by my name, you will find all the information. Any other question? You can just, if you have challenges writing in the chat, you can just raise your hand.
Or unmute yourself and you can come on the screen.
Yeah. That's fine too.
I think that's it.
That's it. No questions?
So
Yeah,
I
it's almost.
maybe I'll just add a point to what Minnie was saying about the need for early intervention is, I think that one of the beliefs that many of us may have is that it needs to be an illness to intervene. And that is not true. And let's think of fever. When you or your child or a loved one has a fever, you might take Tylenol for it, right? You don't wait to confirm that it's pneumonia before you're going to take treatment for it. It's okay to get help for symptoms. You don't have to wait for a diagnosable condition. And most of us, even as a psychiatrist, I'll tell you this, most of us, I'm not good at diagnosing my kids with stuff. So it's okay to go to someone,
Right.
get their input for anxiety. I have a high schooler, in high school, there's lots of stress. Now you got to apply for college, whatever. And the conversation in my parents' group is always about how anxious the kids are. We can't determine, is it normal anxiety? Is it expected for this age? Is it out of proportion? But the burden need not reside on you. So we don't have to carry that burden to decide, what is this? Is this appropriate? Is this not? You can talk to the child's pediatrician. You don't need to immediately go to a psychiatrist for it. And the pediatrician sees enough kids in that age group and can reassure you or can say, it sounds okay, but maybe you need to talk to someone just to get them support, even if it is normal. So I think sometimes we wait to have some final diagnosis before we think we should do an intervention, but we don't have to. We can free ourselves from that burden and actually do the intervention early. That's like secondary prevention, right? Like you intervene really early, maybe a little bit of symptoms have started, but you try to do something to prevent it from worsening.
Yeah. And like you said, I'm going to read your comment here if people can't see it. NAMI is a really good resource in general, although not specific for South Asians. And there is SAMHSA website has a lot of information and also link of the resources by state. And then Department of Mental Health, Connecticut, has a website, and there is a lot of information and resources as well. Okay. Any other question? I don't see it here. So, oh, new message. Okay, let me see. NAMI has many support groups. Thank you. Okay. So thank you, Dr. Mohini, Mini, for participating, and all other participants. Thank
Good job. Keep up the good work.
Thank
Very
you.
good. Very good.
Thank you.
All the best.
Thank you. And any of you are not GOPIO member and would like to become a member, just let us know. We'll send you the form to fill out, membership form. Get the membership. We have very good programs. This is a health and wellness program. We also have a couple of health and wellness programs per year. Kalpana, would you like to say something? Do you have a question?
No, I'm good.
Oh, okay. She
Thank you.
unmuted herself, so okay. No problem. Thank you.
Thanks for the update on the things. Yeah.
Thank you. Thank you.
Thank you. Thanks for having me.
Good night.
Have a good night.
Good night, everyone.
Good night.